Marie, you have prediabetes.
Prediabetes? I don't have time to eat right or exercise. I'm a busy mom.
Oh, you're a busy mom.
Yeah.
This is great news. Busy moms never get prediabetes.
Wait, what?
Let me just... Yeah, this is all the people at risk for prediabetes, and way over here, busy moms. No?
Good afternoon. This is live coverage of Governor Mike DeWine's daily update on coronavirus in Ohio. I'm Karen Kassler, State House Bureau Chief for Ohio Public Radio and Television, in the studios of the Ohio Channel at the State House in Columbus. Thanks for joining us via Facebook Live or tuning in on Ohio's public radio and public television stations, many of which are broadcasting children's programs during these hours of the day that we are doing these updates. And it's great that our audience does now include kids, parents, and caregivers. There is a lot of information coming on what's happening with the state's response to coronavirus and the things you can do to stay healthy and safe at home, since we're all spending a lot of time there if we're following the governor's directives. Let's go right now to the latest update that we have from the state on the breakdown of coronavirus cases. This is as of yesterday, 169 confirmed coronavirus cases in 28 counties, 69 females, 100 males, and yesterday we did log the first death. Mark Wagner Sr., who is nicknamed Mick, he is the father of former State Senator Mark Wagner, the chair of the Lucas County Republican Party, and we send our condolences to his family. 39 hospitalizations, many of those in ICU. The age range of the patients, ages 1, an infant, all the way to 91 years old, a median age of 49. The illness onset February 7th to March 18th. And yesterday also the governor had some new orders he issued closing senior centers and adult daycare centers. That joins the other orders he's issued expanding access to medical and behavioral health sciences via telehealth for those receiving Medicaid. Also, of course, he closed barbershops, hair salons, nail salons, spas, and tattoo parlors, shut down all 181 BMV locations and 52 driver's exam stations. Only 5 BMV locations remain open for processing commercial driver's licenses. Delaying all non-elective surgeries. Also, he delayed Ohio's primary. Still is unclear on when Ohio will vote, though Ohio will vote in the primary. He closed fitness centers, bowling alleys, public rec centers, movie theaters, indoor water parks, and trampoline parks. And he changed his ban on gatherings of more than 100 people, lowered that to more than 50 people. This is just what happened this week, essentially. So I'm here in the studio, joined by my colleague Andy Chow. You have been with me all this time as we're doing these updates. What are the latest numbers? We just got those from the Ohio Department of Health.
So right when we went on air, the Ohio Department of Health updated their website, coronavirus.ohio.gov, and these are the new numbers that they're reporting. Now, 247 confirmed cases of COVID-19 in Ohio. That's 247 confirmed cases of COVID-19 in Ohio that we know about. That spans 33 different counties. 58 of those cases, 58 people are now being hospitalized for COVID-19, and the death rate has gone up. There are now reported 3 deaths reported in the state of Ohio due to the coronavirus. And again, these are just the latest numbers coming in from the Ohio Department of Health. It looks like of those 3 deaths, like you said, Mark Wagner Sr., somebody who's well known in state and local politics. Also, the 2 other deaths coming apparently, as the Ohio Department of Health is reporting, in Cuyahoga County and Erie County. And so what we're seeing in these numbers is something that is in keeping with what Governor Mike DeWine has been warning for weeks now, what Dr. Amy Acton, the director of Ohio Department of Health, has been warning for weeks now, that we are now, as a state, in that surge. We're now seeing that steep increase of the number of cases that we're going to see of coronavirus. And again, always referring to the chart that we talk about, trying to flatten that curve. The state as a whole, with all the orders that you just talked about, is trying to delay the spread of the virus so Ohio's hospitals, medical facilities, staff, doctors, nurses can have the resources that they need to be able to treat these cases as they come in. we jumped from, like you said, 169 yesterday to 247 today. That's why the governor is urging, that's why Dr. Amy Acton is urging people to stay indoors, to stay isolated and to keep in with social distancing, to make sure that we as a state are doing whatever we can to make sure that we're delaying the spread of this virus.
And for those people who are tuning in to watch the latest update from Governor Mike DeWine, we're told that he is going to wait till the press conference that's going on at the White House with President Trump concludes, and he hears what's said there. So then he will join us to start talking about today's update on coronavirus in Ohio. But I want to talk to you, Andy, about the press conference yesterday, because there were some questions specifically about testing and how testing is now ramping up. And I guess that's why we should expect to see bigger numbers like that.
Yeah, and the cloud kind of hanging over the state's head that they've been very clear about is the state is low on testing, that they're trying to do whatever they can to preserve those tests for people who are at high risk to the virus and healthcare staff, healthcare professionals. And so with that being said, they've been saying that, if you feel like you're having these symptoms, you need to get a doctor's order in order to be able to get that test. But if you do not fall in that high risk category, you might not get the test, and you just have to, according to public health officials in Ohio, you have to just treat yourself as if you do have the virus. You need to self-quarantine, stay in your house, stay away from other family members or whoever else is living in that house. And this is just sort of the nature of the situation that Ohio's in right now. They've been very clear that we just don't have the tests. We have private companies, Quest and LabCorp, who are offering tests. We have other hospitals around the state offering tests. They're trying as a state, as that state health department, trying to compile all those tests to be able to show us the data that they have. But in the end, it's been pretty clear that we're not going to know just how many actual cases of COVID-19 are here in Ohio, because there are so many people who might be contracting it who do not have that test to confirm it.
And also, Amy Acton said yesterday that there might be a lag in testing, taking a test, and then getting those results back, because some of these labs are being overwhelmed. These commercial labs that you were talking about are being overwhelmed with getting tests from around the country, and perhaps they are prioritizing areas that have already seen big increases, such as Washington. New York is now seeing some big increases there. So she suggested that hospitals and others who are doing tests send those tests now to the Ohio Department of Health's lab.
Yeah, she's saying that the Ohio Department of Health is able to process these tests pretty quickly. They have the materials that they need. So it seems like it's just, the State Department of Health trying to work with different hospitals around the state, trying to create this network of support for each other. This is something that they talked about 2 weeks, wow, it's 2 weeks ago now, where
it's hard to keep up, isn't it?
It's been kind of a whirlwind, but 2 weeks ago they had a big press conference talking about exactly what the protocols were going to be for this exact situation. And I think a lot of people in that room during that press conference were thinking, why are we talking about this? And now we know it was important to have those protocols in place for this situation. What the state is trying to do is have open communication with every hospital around Ohio, with all the different health networks and with the Department of Health, to be able to optimize all the resources and to be able to send those resources where they are needed, and to be able to work together to be able to provide the services that are needed. And I think what we're going to see in the next couple of days is, if this surge continues to rise, if you see these cases continue to rise, we are going to hear more stories about if these protocols are working, if the state needs to call an audible and try to change things around a little bit. The DeWine administration, Governor Mike DeWine himself, has been very clear that they're sort of just kind of working on their feet at this stage of the game, where everything's constantly evolving. So what might work today may not work tomorrow. And I think that's, again, why he keeps having these press conferences too, to constantly be upfront about what's happening, and to constantly be informing the people of Ohio of what's going on.
And the big thing that they have talked about every single press conference has been that flattening the curve. Mm-hmm. The idea of trying to spread out the cases of COVID-19, the serious ones, the ones that would go to the hospital, that would need intervention, to try to spread those out over time so there isn't this spike of illness right away, which would overwhelm the health systems, which would be a serious problem when we are potentially moving into an area where there could be shortages of medical supplies. We're not at that point yet. We're not at the shortages point yet, but it's been said at these press conferences that conservation of personal protective equipment, PPE, and all that other stuff is really important right now.
Yeah, they're trying to make sure that they have as many ventilators as possible for these cases, and to have as many items of PPE, personal protective equipment, so face masks and gowns and things that can protect healthcare workers, because they are on the front lines of these things. The doctors and the nurses are face to face with these cases, and they need to do whatever they can to stay healthy so they can continue to treat people. And so again, we're sort of seeing each hospital sort of tackling this in a different way. I'm hearing reports of one of the local hospitals sort of, because the state has ordered sort of to try to limit elective surgeries, you're seeing a lot of staff in one area that's in that elective surgery area being shifted to some of the more high-risk things. So you're seeing more resources diverted to these cases that are about to come into hospitals. And so again, these are nurses, these are doctors, these are staff that are sort of gearing up for what they expect to be a pretty steep climb in cases. And we say there are 247 confirmed COVID-19 cases in Ohio, and like we've already said, it's pretty clear that there are more than that. If it gets to the level where somebody needs to be hospitalized, then of course you're going to see more tests being carried out in order to confirm those cases. But again, 58 people are being hospitalized in Ohio for COVID-19 at this time.
And Dr. Acton said yesterday that there are no areas that are spiking individually. I mean, there's some areas that have some concerns. She specifically talked about an area in Miami County that's seeing some cases coming in from a nursing home there, but that we don't have the big spikes yet. And the whole goal, again, is to keep those down. But she had warned earlier that there are going to be Wuhans all over the country, places that are going to be hot spots. We've seen that in Seattle. We're starting to see some of that developing in New York City. There's some concerns about Miami. The whole goal is to try to make sure that no Ohio city makes that move up.
Yeah, and what we've seen ever since the beginning of this virus, where you see when China started to be more upfront about what they were doing to contain the virus, what South Korea and Singapore have been doing, what you see as sort of one of the best practices here is that when you do this social distancing, when you make sure that everybody, as many people as possible, can stay in their homes, then they're able to sort of draw a circle around different cases and really isolate that situation. So if you don't have as much movement going from one Ohio city to another Ohio city, then there's less things to track. There's less of that contact tracing that we learned about a couple of weeks ago, where epidemiologists, right,
yeah.
where epidemiologists who are known as disease detectives, when a case is confirmed, they talk to that person and they do a pretty intense screening, and they say, where have you been? Who have you talked to? Who have you come into contact with? And they sort of spread out to try to get the word out to every single person who may have come into contact with that case, to let them know about the situation. And if you are able to, as a state, if we are able to carry out social distancing, then we are able to kind of create a bubble around each city, around each case. So like you said, we might have a couple of hot spots where things start to spike, but if they're able to contain that to that zone, then that helps the state as a whole to be able to continue to carry out and to be able to still slow the spread of that disease.
I know one thing a lot of people are wondering is, okay, bars and restaurants are closed, bowling alleys, fitness centers, hair salons, all these places that are closed. When would the state might issue an order for closing of non-essential businesses? Mm-hmm. And of course, there's all the daycare questions about why daycares are still open. There was some talk yesterday during that press conference about the idea of closing non-essential businesses.
Yeah, Governor DeWine said that this is something that he's grappling with every day, where he's trying to find a balance. I think what he was basically, what he has been upfront about is that if he were to just do a wholesale close everything, then you have a couple of different issues. You bring the economy to a standstill, and then you end up taking away, income and livelihoods for a lot of employees who might think that they should still be able to go to work. There's a lot of employees out there and a lot of employers out there who believe that they themselves can continue to carry out their business in a safe and clean way. But Governor DeWine said that there have been reports of businesses around the state that are acting, in his words, reckless, and that are not adhering to the the protocols that they should be to maybe take your employees' temperatures, clean surfaces, make sure people are washing their hands and not touching their face all the time. That's something I've had a lot of trouble with lately, is not touching my face. And so the problem here is you do have reports of employers around the state who are just not taking it seriously. And he basically said, hey, you got to cut it out. And then Lieutenant Governor John Husted came around and kind of issued an even more forceful warning of, don't be knuckleheads here. And so what you're seeing here is DeWine is saying he's trying to balance, if his decision were to shut down the economy, or is the decision going to be to keep people safe? And he says that when it comes to that balance, he's always going to err on the side of keeping people safe. So I think that's what we're seeing here, is he's every day evaluating the situation, evaluating if businesses can continue on as normal as long as they're staying safe, or does he have to just shut down non-essential businesses? Now, the second thing is, what is a non-essential business?
Exactly.
And I think that's another thing that he kind of alluded to. And then we were talking to his staff later in the day yesterday about sort of this list that advisors are compiling. What does it mean to be a non-essential business? What does it mean to be an essential business?
I mean, when you think about things that you access every day, as I was driving into work, I was thinking about, I want to get an oil change in my car. Is
Right.
is that essential? And those are the kind of businesses I think that DeWine is looking at and saying, we need to make sure that employees are being treated there as safely as possible.
Mm-hmm.
And so, yeah, I didn't mean to interrupt.
No, and you're right. And so one of the cases that we've heard reports of is that maybe call centers are not doing a good job at keeping their employees safe. But call centers, depending on what kind of call center it is, can play a very important role in all of this. Call centers are the types of places that take in complaints, take in requests. You might have an influx. What we're seeing, and this is not the case, but we're seeing a huge influx in the amount of requests for unemployment compensation. Now, we're to assume that the state is handling that in the right way, but you got these private companies that carry on call centers that provide an important service. Is that an essential business? Is that not an essential business? Something else I also think of is a delivery service. So an online retail service where you order important supplies. If you're trying to personally not go outside, you might be using that online retail service to have a lot of things delivered to your house. Is that essential or not essential?
I think in this time where people are being ordered to stay home and told to stay home, that a lot of people would say absolutely any sort of delivery business is absolutely really important, critical to me at this point. But
Right.
when you start talking about shutting down not essential businesses and essentially locking things down, where do you make the exemptions? And I think that may be one thing that the governor and his staff are maybe looking at, as they are also warning businesses, you need to behave and follow the rules and make sure that your employees, if they're sick, they can go home, that you're keeping the proper distance between you and between employees in your office, that sort of thing.
Yeah, and since it looks like we have more time, let's really get into the weeds
Sure,
of this.
why not? I'm monitoring here. The governor has told us that he's not going to come out and speak until after the White House press conference is over. So we're waiting for our colleagues in the White House press to conclude their questioning of the president and Vice President Mike Pence and all those folks, and then we'll see Governor Mike DeWine here. So let's talk a little bit more.
Right, like if we're going to get into the weeds, you and I, we cover things at the State House. We cover legislation and different policy. And what we know is that when a legislator or when a policymaker is crafting an order or a piece of legislation, they try to be as very careful as possible, or at least, the goal is to be as very careful as possible, because what you write down in that public health order becomes basically the law, or it becomes
it's an absolute directive
That's
on
right.
people and businesses and folks.
And so what we see all the time here at in the legislature is trying to avoid what are called unintended consequences. So if you do write a bill and it tends to maybe overreach, then the only way to fix that bill is to come back again and have everybody vote on it to make that fix. And I think that's kind of going into everything that's happening with the governor here, is that if he were to do this big sweeping order to close down non-essential businesses, what are the unintended consequences? What kind of guardrails does he need to write? Does his staff need to write into that order to make sure that, it doesn't automatically shut down a company that maybe needs to stay open for one reason or another? And he has been very clear about that being sort of the issue here, is that if he were to write this order, it's got to be pretty clear, it's got to be concise, it's got to be something that does not cause even more confusion later.
Well, and for business owners and for workers in those businesses, this is all very critical, because obviously business owners have to make the decision on whether they're going to close their business and stop all the revenue coming in, whether they're going to continue to pay their workers or whether their workers are going to be laid off and go on unemployment. And we've seen a huge spike already in unemployment numbers. We went from, a couple weeks ago to 139,000 as of reported yesterday. So for businesses to try to make that choice, some of them say they want an order. They want the governor to tell them to shut down so they would be able to make that choice more easily. But then, of course, that sets a whole other set of issues into motion.
Yeah, it kind of just creates that avalanche rolling down the hill here where, apparently, and this is what we've seen anecdotally, is that you can't make everybody happy. There are plenty of businesses who are very upset, and for good reason, that they had to shut down. There are plenty of businesses that are starting to close because of this, or warning that they are on the verge of closing because of this. Like you said, though, there are other businesses that are able to stay open, but they're grappling with this idea of, listen, I can stay open, we can keep our business going, but am I putting my employees at risk, or am I putting their health at risk to continue this to stay open? And we've seen, on a bright side, we've seen a lot of really creative ways that businesses have been trying to keep people safe. One of my favorite coffee shops here in Columbus has created basically a new way of delivering coffee to people to make sure that people can still stay safe and limit the amount of contact they have with each other. But in the end, this is something that every business has been trying to grapple with on an individual basis. And that kind of goes back to the whole thing about Governor Mike DeWine creating this big public health order where you have all these different businesses around the state trying to navigate through this. And then if you have a big sweeping order, how does that fit into the picture?
Yeah, I made a stop at a pharmacy on my way here, a pharmacy that sells, CVS. Okay.
Yeah, sure.
And there are X's on the floor as you're standing in line to keep people separated. And I was also told that if you're coming in for a prescription, you come in, you drop off your prescription. If you don't want to use the drive-thru or whatever, they will tell you to go in your car and wait, and they will bring it out to you. So, like you said, it's a creative way, different creative ways to try to keep people separated, to keep business going. Now, a place like a drugstore like this is not going to be one that's going to be ordered to shut down because of the presence of that pharmacy. But I think that there's a real effort to try to keep people apart in grocery stores and other places, in restaurants that are still open and doing takeout. The idea, don't have people congregating, waiting for their orders all huddled together. Keep people apart.
That's right. And you bring up a good point, because we hear all the time that nurses, doctors, medical staff, that they are on the front lines of these things. And they're absolutely right that these healthcare professionals are on the front lines of the coronavirus. But other people who are, I would also consider on the front lines, are the pharmacies and the grocery stores. These are places that we've been told over and over again will not close down because people still need their medicine, people still need their food. And so that's just kind of going along with it too, is that these places, the pharmacies, the grocery stores, are trying to find a way to be able to keep themselves safe, keep their employees safe in this time where you have a lot of sort of uneasiness. Lieutenant Governor John Houston mentioned yesterday about reports of people fighting in a grocery store over toilet paper. And, he had another one of those cut it out moments there.
Football coach moment,
right,
as you talked about it yesterday.
Right. And he was basically saying, when you look back on all of this, when we are through this storm that the DeWine administration has described it as a storm, when we get through this, how do you want to remember yourself? How do you want to remember how you acted through this? And I think it's a good thing to mention that there are pharmacies and grocery stores that have to stay open, and they have to deal with people going through all sorts of personal dilemmas. And I kind of saw it the other day when I was at a pharmacy, where you saw somebody walk in and be sort of abrupt and curt with the employees. And these are employees who have to be there. And they want to be there because they believe that what they're doing is important. And
yeah, they absolutely want to be there because, of course, being paid at this point is people are losing their jobs. Restaurants are closing. Our colleague Joe Ingles did a package for our TV show, The State of Ohio, this week, talking to some business owners, one in particular who runs an indoor rock climbing facility that got shut down, and how they're having to go through this painful process of letting employees go, people who might have worked for them for years. Meanwhile, on the other side, you do have places, grocery stores that are hiring, can't keep up with the demand of people coming into the store, but also they need to stock the shelves, they need to sanitize the store and that sort of thing, which is why a lot of grocery stores are pulling back their hours. Grocery stores that used to be 24 hours are now, 7 a.m. to 10 p.m., for instance. The whole idea being we got to have time to restock those shelves so that when people do show up, there's something there for them.
Yeah, and you know what? The DeWine administration has been trying to put it out there, too, that they understand what's going on. They understand just how big of an impact this is on people's lives, on the economy. The DeWine administration actually just tweeted out today the special video that they made with the hashtag In This Together. And the message of that video on DeWine's Twitter page is that it was recognizing all the tough decisions that had to be made for barbershops to close, for gyms to close, and it kind of spotlighted places like barbershops that closed before they were told to close because they on an individual basis believed that it was the right thing to do. And so I think what you're going to see is kind of more of this because it's a balance of a lot of things here. The state is, and with all these public health orders, are sort of this action to try to keep people safe. But they are also being looked at, I think DeWine's being looked at, Dr. Amy Acton is being looked to as sort of a morale booster as well to try to sort of keep up positive spirits. I think it's very clear that when they had First Lady Fran DeWine a couple of days ago at one of these press briefings, it was sort of to try to bring a calm spirit to things and say, listen, we know you're at home. We know you're going through turmoil right now. And here are some things that I suggest to you. And, people kind of laughed a little bit about suggesting different recipes, but there are a lot of people out there who are now
cooking at home,
baking pies, making chicken noodle soup. It is something. I know my wife, she has already made 1 or 2 loaves of bread out of this. So, I mean, this is just something that has been happening lately because people need that morale booster.
And that's smart because bread can be hard to find.
Right, well, we ran out of bread, so we just had to make it.
There you go.
Yeah.
And I think the presence of Fran DeWine, I mentioned at the top of the show that we're now live on public radio and public TV stations. Some of those TV stations are doing children's programming. Mm-hmm. And so to have a calming presence like Fran DeWine really can soften the blow maybe. I think a lot of people might have been confused as to why is she talking when we're here to hear the governor. Well, I think that may be a part of it, talking about activities that parents and kids can do together at home, reading and cooking and things like that. We're going to be at home a lot. I mean, you and I aren't at home,
right.
But if you're following the governor's directives, you are at home. Mm-hmm. And that can be really challenging for parents who are trying to work from home, mm-hmm. kids who are off for school. We know that's going to be extended past April 3rd. The governor has said that. Yep. It feels a little bit overwhelming sometimes.
Well, and I think the other thing is and there are a lot of people out there watching the television, listening to the radio, trying to stay informed, and that means that their kids are listening to the things that are being said. And I had kind of my own personal experience yesterday where my 4-year-old daughter sort of reiterated to me that there are people who are sick right now, and that's why we have to stay home. It was kind of a heartbreaking moment, but it kind of reminded me that this is something that's impacting everybody, and it's important to try to figure out how to navigate through this, how to talk to our grandparents and how to talk to the elderly about what's going on, and how to talk to our kids about what's going on. And I think that's something that you've heard from the DeWine administration to try to figure out a way to balance, and we've been saying the word balance a lot lately, but to try to figure out a way to balance taking this seriously, making sure that you're doing everything that you can to prevent the spread of this disease, to delay the spread of this disease, but also not panicking. And it's something that kind of carries over to our older loved ones and our younger loved ones.
And I'm still keeping an eye. I had to switch from my phone to the iPad to keep an eye on what's happening. What we're waiting for is the press conference at the White House to conclude. The President Trump has left the area, but Vice President Mike Pence is still here. And so we're waiting for that coverage to conclude because Governor Mike DeWine is watching this to hear what's being told to reporters there before he comes out and does his briefing here live and in front of reporters, though. I'll let you explain the situation in the room there. We've gone from a tiny little press room, kind of press conference room, to what's the setup now? Well,
and as somebody who loves to have access to top officials, it's rare for me to say this, but I am kind of happy that we've been separated a little bit. This whole thing has evolved for a while now. When we first started these daily press briefings, it started in the typical common Harding press briefing room here in the State House, and that is a small room, especially with just a few dozen reporters. You're kind of cramped, you're shoulder to shoulder, and everybody in the room realized this is not conducive to a safe work environment when we're talking about social distancing. So we moved to the Senate Finance room, and it's a much bigger space where we were able to spread out the chairs, still wasn't good enough, especially because the CDC came down with rules about mass gatherings, and then shortly after that, President Donald Trump said, listen, we gotta limit the amount of people we're hanging out with to less than 10 people. More than 10 people in that Senate Finance hearing room. So again, it moved again. And so now what we have is just a couple of individual rooms around the State House set up with TVs and a video or a camera and a microphone so that we're able to talk to the governor, we're able to see the governor, still have that communication, but we are not physically in the same room right now. Again, we're here to, to be able to provide the information that people need to know about so we can keep everybody informed, but still we are also, as reporters, as journalists, and everybody else, trying to adhere to these social distancing protocols.
All right, so it looks like we're going to be getting started here shortly. The press conference in the White House has ended, and so we're expecting Governor Mike DeWine, Lieutenant Governor John Husted, and Dr. Amy Acton to come out at any moment. But until they do, Andy, I think that's a great explanation of that social distancing. And you and I, for people who are concerned that Andy and I are too close, we're actually not. We're practicing this social distancing, have been all along. And as the number of people in rooms starts to get lower, we actually have a few more people in our room. If you were watching the press conference yesterday, you might have noticed that the interpreters that the governor has had with him are now in a box, in a screen, and they're actually originating from the Ohio Channel studios with us here. And so it's the idea, once again, of keeping people separate to really stop the spread of the disease because it moves from host to host, essentially.
Yeah, that's right. I mean,
they're across the room from
us. Right next to us right now. So, and thank you for everything that you're doing. It's a very important service, and it sort of shed light on this issue, 2 weeks ago when the interpreters came in, is that everybody needs to know about this. Everybody needs to stay informed, and the state needs to do whatever it can to expand access to as many people as possible to this information. And that's just a signal to one of those things. Yeah, when we talk about these press briefings, a lot of people have said that it's helping keep them informed. And so what we're seeing now is that the DeWine administration has been trying to keep with transparency and to make sure that the information that people are getting is coming straight from them and it's not coming from a bunch of different sources bouncing back and forth. That's why you kind of see, people don't have sports to watch anymore. And so,
sadly, no. In fact, one of our followers kindly referred to us as his new sports programming. So that's very nice.
That's right. And so we're big advocates for transparency and to provide as much information as possible. And so that's why we're here.
And also on the subject of information, the DeWine administration has talked about misinformation that's out there. One of the things that he's mentioned is, yes, the National Guard is going to be deployed, but they're being deployed to help at food banks because a lot of food bank volunteers are in that category of high risk. They're older, and so they've decided not to volunteer anymore. So 370 personnel from the Ohio National Guard are being deployed, but they're, as DeWine says, not going to be carrying guns. They're going to be carrying groceries. But that's the idea of getting that information out there and telling people, make sure that you're getting your information from reliable sources, not from some of the things that we're seeing circulating on social media.
That's right. And when we check before we go on air, we check our emails, we check our social media to see what's out there. And sometimes we get requests for questions. And, about every day you sort of hear the latest myth of the day. Is scenario B true? Is scenario A true? No, most likely not. These are sort of just factual errors that are out there. And I think it's been pretty clear that Dr. Amy Acton has been following those things too, because a lot of these myths are based on sort of medical science. And so she's been sort of following those too. And she'll also go to the lectern and say, let me start off by saying, if you've been hearing this rumor, no, this is not true. But she's also been very clear to say that she's been very impressed with the speed at which medical research has been going throughout the past couple of months, how they've been able to fast track a lot of things, to look into antivirals, to research a vaccine. And that's just been something that, again, the state is monitoring very closely. We're not quite there yet, it seems like, but it's something that they are on top of.
And that's the reason why the social distancing and the staying at home is important, because right now there is no vaccine. The treatments and the drug research is ongoing, but there's nothing there yet. And once again, the idea of a huge number of sick people overwhelming hospitals, there's a limited number of ventilators, there's a limited amount of personal protective equipment, there are a limited number of actual workers in this field. And so we want to flatten that curve, lower the number of people who will be spiking and moving into hospitals right away, and flattening that out over time. But that's another thing that I think the uncertainty of all this is really agonizing for people. When is this going to end? And DeWine and Acton both say in these press conferences it is going to end sometime. We just don't know when. And if we're all in this, we can make that end come quicker, maybe.
Yeah, and you know what? Something that spoke to me personally is this idea of it's not a sprint, it's more of a marathon, and you got to create your own fun habits now, your own routines now, because you can't just try to skate by from this week to the next. You got to realize that what we're doing this week and what we're doing next week, it's going to be here for a long term. We will get through this. Hopefully we get through this as safely as possible. But I thought it was interesting that Dr. Acton sort of said, create some healthy routines now. So you kind of create things to look forward to. I know that I've heard from different families who have scheduled sort of outside time without interacting with other people, but being able to go outside, to know that every day you're going to go outside and play for a little bit.
You can go for a walk. You can go
yeah.
for a bike ride. These are things that are still possible. And you can go out and speak to your neighbors from an appropriate social distance.
Well, we saw our former colleague Bill Cohen lead a sing-along in his neighborhood apparently last night, where everybody was able to spread out across the sidewalk, and he was able to sing some songs. He's a well-known folk singer in Central Ohio, and so we're seeing these types of things happen all over the place, and it's important to try to basically maintain your sanity when you're inside and trying to stay cooped up for a long time, but create some sort of healthy routines to be able to get outside and have some fun.
So we're told the governor is coming in very shortly. Just a little recap of what happened yesterday. He announced the closing of senior centers and also adult daycare facilities. We have not yet heard anything about daycare facilities for children, though the governor has said the numbers of kids in those daycare facilities have been dropping dramatically. He's just concerned about the number of kids who are in those facilities who are the children of healthcare workers and grocery store workers and that sort of thing. And here comes Governor Mike DeWine. Actually, he's on his way to the podium, and we'll now turn it over to Governor Mike DeWine for today's Corona.
Earlier today, we received the very sad news that State Representative Don Manning had very unexpectedly died. This was not from the coronavirus, when we were willing to understand that. This was following chest pains yesterday and a short hospitalization. Don was only 54. He worked tirelessly to advance issues important to the Mahoning Valley. Really did a wonderful job representing the Mahoning Valley at the State House. He helped workers at the GM Lordstown plant. Was a strong advocate for them and for economic development in the Mahoning Valley. Don was always looking out for his constituents. No one was a more passionate proponent. He was a passionate advocate for those with mental health issues as well, and I admired him a great deal for that as well. It was my privilege in December to sign a very important bill that he wrote, House Bill number 12, which created the Ohio Children's Behavioral Health Prevention Network stakeholder group. And during the coronavirus crisis, he worked with us in getting information out to his constituents. He would email me or text me with ideas. He would do the same thing for Dr. Acton, his fellow Mahoning Valley native. Don was a Navy veteran, and we appreciate his service to our state and to our nation. Fran and I extend our most heartfelt condolences to his family, to his children, Sean and Taylor, and all members of his family at this very, very sad and difficult time. In a moment, Dr. Acton will give you all an update in regard to the coronavirus. And what she will tell you is certainly not good news. But I do want everyone to remember that none of this is really a surprise. We should take this very, very seriously, but it really is not a surprise. This invader, this virus, continues to infiltrate throughout our state. Community spread is, at this point, widespread. And as you listen to her, please keep in mind that none of this was really unexpected. This was predictable. So this is, though, a very, very critical time. And I want to talk to my fellow citizens of Ohio about this time and the actions that we must take. What we do now, what we do not do now, will really determine ultimately how many Ohioans die. This is an absolutely critical time. We determine, and we have in our own hands, how fast this will spread. We've talked about flattening the curve. We've talked about the steps that we absolutely have to take in order to allow our health system to survive, our health system to be able to deal with this crisis. There was a map and story in the New York Times this morning that I read online last night. And this is kind of the summary. This is what we do with no control measures. Now, we've already started control measures. We're well into it in Ohio. Some control measures, severe control measures. This is what it would look like by July. Percent infected by July 1. Now, this is a snapshot in time. It's a modeling. We don't know if it's going to turn out exactly like this. But this is based on good data. Good data about what could occur. I'm a big fan of the Back to the Future movies. Anyone who watches those movies know there can be an future alternative. And there's many ways, depending on what you do here, depends on where you end up. And if you do something different here, you have a different outcome. And so I'm appealing to my fellow citizens. Ohio needs to be back here. This is where we need to be. Now, we've announced a number of measures. We will have more measures. We'll have more discussion about this and more news tomorrow. But this is not just what government does. Government can only do so much. The personal interactions that we have, how well we follow the CDC recommendations, how well we separate ourselves, how well we say no to trips, how well we say no to getting in the car and doing something that's not absolutely essential. That's going to determine what our future is. What we do now, today, tomorrow, will determine how many of us die. It's as simple as that. You've heard me talk about, use the term that this is no ordinary time, and I've likened this to a war. I didn't make up the term no ordinary time. That was used by First Lady Eleanor Roosevelt at the 1940 Democrat National Convention. This is part of what she said. And I think it's instructive for us because we are in a war. The United States in 1940 was not quite in the war yet, but a raging war was going on in Europe. This is what the First Lady Eleanor Roosevelt said. This is no ordinary time. No time for weighing anything except what we can best do for the country. This is no ordinary time, no time for weighing anything except what we can best do for the country. So we need to focus on this. We need to focus on what we do as citizens to protect ourselves, our families, and everyone else in Ohio. We must act as if we have been invaded by an enemy, because in truth, we really have been. We must not do anything to help the enemy. As we talked about several days ago, this enemy cannot advance. This enemy cannot move forward without our help. We need to do everything to defeat it. Just as last Saturday night and then Sunday morning, I started getting texts all over the state from people all over the state about bars being open and people congregating and coming together. About 10 or 11 o'clock today, I started getting calls and texts from people around the state telling me that Saturday morning, at least where they were, sort of looked like a regular Saturday morning. We can't have any more regular Saturday mornings for a while, just like we can't have any regular Saturday nights. Each night when I go to bed, I ask myself, did I do everything I could? What else can I do? What else can I do? And did I do everything I could that day to defeat this enemy, to slow it down? And so I would ask all of you, every night when you go to bed, to ask yourself, have I done everything within my power to protect us? Everything to slow it down, everything to stop it from going from one person to another. This is a silent invader. It's a silent invader because many times people do not know that they have it. Just don't know. And so assuming that everybody has it, assuming that it's here, because it is here, as Dr. Acton will explain in a moment, and it's infiltrated throughout our state, we have to assume that. And so I would just ask you, as I ask myself every night, have I done enough? Did I do everything today that I could do to stop this? I would ask you to ask yourselves the same thing. We control this. We control our own destiny. Let me talk about a few things that I'm ordering today. But first, let me describe, because I don't think I've talked about it, the EOC, the Emergency Operating Center. This is a center that was established many years ago. It is run by a veteran in these battles, Sima Merrick. It's used for floods, it's used for tornadoes, it's used for any kind of emergency that we might have. Dr. Acton, along with Sima and everyone at the EOC, have really meshed this operation together. So, as Dr. Acton talks to you today about multiple hot spots around the state, I want to assure everyone that this EOC is there, it's functioning. Dr. Acton is using it as an arm, very, very important. It is a command and control center. It deals with supply chain logistics. We have so many of you who have offered help many of you who are making sacrifices, many of you who are companies that are producing products and doing things, and making sure that we can track that, we know where they are, is just vitally important so that we can get these things to the people who need them. We are clearly in a full response mode to this attack. I want to assure you that it is working and is working well. Let me talk about an order that we've been looking at for some time, and that is adult day services for people with developmental disabilities. And let me tell you about the order that we're issuing today. The individuals who I'm talking about today are people with disabilities who receive care every single day. And our concern is for them, as it has been for everyone else, that they congregate in large numbers. That is not good. That is a danger to them. We face, though, the challenge of making sure each one of them was able, if we close these centers, each one of them would be able to get the services that they needed. Today we can say that they will get these services, that there's provision for each and every one of them, and therefore we're going to issue the order today. Today we're issuing an order that closes adult day services across Ohio, with the exception of settings of 10 people or less. Across Ohio, over 26,000 of our fellow citizens, people with developmental disabilities, leave their homes to receive group-based services during the day. These are called adult day services. Adult day service locations are a place for people with developmental disabilities to get work training, social and recreational opportunities, and skill building. Group sizes vary from as small as 4 people to as many as 100 or more. There are a large number of people with developmental disabilities in adult day services who are aging and who have health conditions that make them particularly at risk. Many people live in family or group settings and then travel to their adult day services, creating increased exposure when they go and when they come back. Some locations are already closed or downsized, and families, guardians, providers are and have made the tough decisions to keep people home, and I applaud them for doing that. But we felt it necessary now, for the safety of those with disabilities in larger groups, to close them, and we'll feel confident that now that we can do that. Small groups and services in a person's home can continue while following proper precautions. Further, we're encouraging providers and direct support professionals to work creatively to continue to support these individuals, which they're going to do. We've been working with the providers to make sure that there is a place for each person to go and for them to be able to continue to get the services that they need. We remain grateful to the providers and to direct support professionals for rising to this challenge and for their commitment to support some of our most vulnerable Ohioans, some of our most valued, some of our most loved fellow citizens. Well, now I ask Dr. Amy Acton to come up. She'll be followed by Lieutenant Governor John Husted, who's been doing, as has Amy, a phenomenal job as we go through this. And then we'll be followed with Lori Chris. And I'll say a few things before I introduce Lori. Amy?
Thank you. Good afternoon, everyone. I want to begin today by reminding you that every one matters right now, and every day matters. And this is the time we've been talking about where you absolutely have to take the governor's advice to heart. And I'll tell you a little more about what I'm seeing here in Ohio. But first, I really want to please send my condolences to Representative Manning. He's a colleague. He died of a heart attack, I'm told. We talked as recently as Wednesday. He's from where I grew up in Youngstown, and he is passionate about helping the folks in that area begin to get their minds around what is happening. His background is mental health and behavioral health. As you heard about the most amazing legislation he had done on that behalf, and he had been in constant contact with me, asking me ideas, sharing me his ideas about how we could reach more people. And so please, Youngstown, everyone around Ohio, and definitely in my hometown, you know, he was trying to tell you, take this seriously, and it is a tremendous loss and one that's hard for me to really comprehend right now. I want to talk about the science and community spread. If anything, as you know, that has been my job here from the beginning. There is a fallacy out there, and it is so important that we move past this. There is a fallacy that Middle America is not impacted by this to a large extent. We know, as I told in an earlier taping, and if you want to go back and look at that, we are a state of 11.7 million people, the 7th largest state, a sister state of Hubei province, with extensive businesses with global impact, with extensive universities, public and private, with students and professors in exchange. And everything points to the fact that we had a seeding of this infection early on, and we were one of the last states to get the reagents we needed to do testing. And our case numbers are a history snapshot of the past. They are not telling the full data and the full story of what is happening here. And I need you to look at what's happening on the ground to understand the full impact of what is happening here. It was, in fact, like I've said before, it is the seeing a star at a distance. You're seeing a snapshot of the past. Even what goes on in the future in the next few days is still minimal because we are conserving all our available testing for the most high risk and hospitalized and frontline workers. So we are withholding the most of our testing in our lab because we are running out of reagent. And believe me, we have ingenuity here. Believe me, Ohio State, Cleveland Clinic, and others are inventing every component of the testing kit. But you are looking at a snapshot of history. The work by the modelers that the governor showed, the charts that were in the New York Times, they are a snapshot of what's going on in Ohio, because even the modelers are having to use the best data they can get, and that is incomplete data. So it's very, very important to realize that we have now 247 confirmed cases, a snapshot of what's going on. We have onset of illness from February 7th to March 19th. We have an age range of age 1 to 91, with an average median age of 51 years. We have 58 people hospitalized, multiple in ICU. We are taking people off of ventilators in Ohio. We have 3 confirmed deaths today and multiple that are still under investigation and have already been reported to the media but have not come into our data center yet. We have 31 counties impacted, knowing full well that people are coming from other counties and being recorded in larger medical centers. We have hot spots in nursing homes on the ground in Dayton area, in Tuscarawas County, in a small area of Ohio, and in Cuyahoga County in Cleveland, in a big city. We are seeing this on the ground. I sometimes feel that I am in a war zone, I'm going to war, and I'm coming back home and wondering why everybody at home doesn't see what I see, because you can't see the scurry and the flurry of activity that's happening on the ground at the local level. I implore the media, you help us so much in this, to go to the local level and see what is happening. I want to tell you about innovation that's happening in Middle America right now. I want you to go to Cuyahoga County and talk to Health Commissioner Terry Allen and his medical director, Heidi Gullett, who's head of the preventive medicine program at Case Western Reserve University. I want you to talk to them about their amazing 5-layered triage system where they're following cases, presumptives. They're creating whole tiers of doctors trained in preventive medicine who are taking on each high-risk nursing home in their area and long-term facility. And there are a new army of people out on the ground doing case histories and contact investigations. They're doing surveillance in high-risk clusters without all the available testing. They're using their tests wisely. And then they are going even to family clusters. You need to tell the story of these innovators on the ground, and we need to get over this thought, yes, we are behind Washington by days, by a week. We are behind New York in seeing what they're facing, but we have to take the recommendation of these modelers. We have to take the recommendations of the best available data that we have from Dr. Shaman, from Northeastern University in Boston, Dr. Vespignani. We have got to realize what they're saying to us, that those of us who have the days, not weeks, to take these measures need to take them now. We will benefit most. Others did not have this opportunity. I want to say that these measures we're taking, we are equally working with the best scientists and people around the world to figure out the economic impact, because it is no small thing. Every one of these decisions has rippling consequences, cascading effects. It has effects on people's health every time we have to make one of these changes. Vulnerable people are the most at risk, and we're looking at that social vulnerability index. We are working with our nonprofits and philanthropy, and you'll hear more and more in days to come. These are hard choices, but these are the best tools we have, and we must use them now. We are seeing endless good deeds as well, and I just need to do a shout out. I told you yesterday about a bakery delivery that did not happen to a nursing home overwhelmed right now. I want to tell you that Gordon Food Service and Klosterman Bread stepped up. They'd made deliveries to the nursing home. Hampton Logistics, a small business carrier, said that they could transport 2,000 pounds of anything needed delivered. We do have an emergency operating system. We are building logistics that have never existed before, because this is an unprecedented public health emergency, and folks are stepping up. I heard a story in the Columbus Dispatch of a small business that was still doing carryout, but was saying goodbye for the last day, and of a customer who overheard that and left a $2,500 tip to help the workers there. So this is absolutely the truth. Human and economic development, they're inextricably linked, and every one of these decisions is going to take the best scientists and the best people helping us remove what we can when we can, and I want to work with you on that, and so does my team. Ohio, we've talked about the hurricane analogy. We've talked about the fact that you want to evacuate while the sun is still shining. We talked about how difficult it is to build these systems when it's in the middle of the eye of the storm. We are in increasingly heavy rain. This is the time to batten down your hatches. This is the time to stay at home in place. And I look forward to working with all of you in the days to come.
Thank you, Dr. Acton. Dr. Acton and I had a great conversation earlier today, and you just heard her talk about the cascading effect or community spread from a health point of view. But we also understand that that has an economic consequence as well, that there is a cascading effect in the economy, that there is a community spread in the economy in the sense that businesses are going to suffer, and as a result, so will their employees. And we're very mindful of that, and always trying to seek the balance, which is the tough task that the governor has, the tough decision-making process the governor has, and Dr. Acton and I we're trying to pull people together to make sure that we're finding the balance of that conversation. And so that you know, we are not making decisions in isolation. We have a great team from the governor's staff, my staff, the entire cabinet, who's working with the business organizations of this state, who represent everybody from retail to manufacturing, all down the line throughout the economy. We talk with the local chambers of commerce. We talk with different types of business leaders to help advise us on the impact of our decisions and how we can minimize the impact as best we can as possible while also being healthy. And I have a couple of announcements today based on their great feedback. The first one is regarding the Bureau of Workers' Compensation. Bureau of Workers' Compensation provides the insurance that covers injured workers. It has been well managed and is in a position to help. And so what we are announcing today is that the Bureau of Workers' Compensation is going to make sure that businesses can forego payments for March, April, and May and defer them until June 1, 2020, at which time further consideration will be given based on where we are in fighting this pandemic. The Bureau of Workers' Compensation covers 249,000 public and private employers. This decision will leave $200 million in the economy through the deferral of those payments. For more information, you can go to bwc.ohio.gov. I want to thank Administrator Stephanie McLeod and her team and all of the staff and the business community who worked to advise on this issue so that we can provide a little relief during this difficult time. Another piece of feedback we received out there in the supply chain. We had grocers and people who deliver medical supplies ask if they could have a waiver from the Department of Transportation in seeking the weight and size waivers that they need to provide larger loads of these vital products to the healthcare and the food supply chain community. I'm announcing today that the Ohio Department of Transportation will be granting those waivers for haulers carrying essential goods. They will be able to print that permit and carry it with them. And the permit fee for oversized loads containing supplies that we are referring to in terms of the critical supply chain, those permits fees will be waived. You can find more information at transportation.ohio.gov. So these are a couple of examples of things that businesses have told us will help them, that we are trying to do to give them that relief, and there certainly will be more to come as we work through this. Reminder for small businesses who that Ohio has been declared a disaster relief state, and so you can find loan information from the Small Business Administration to help you get through this difficult time at disasterloan.sba.gov/ELA. And another reminder on health insurance. There has been a grace period granted under the governor's executive order through the Department of Insurance that will defer premium payments for all health insurers for up to 60 calendar days. And so those are just some of the issues that we've been able to work through now in the early days of this process. More will be coming, and we appreciate the ideas and the cooperation, because truly there are innovators out there in business that are helping develop the supply chain on medical supplies, using technology to do some things that we previously didn't think that we had the ability to do. And so keep it coming. We're all in this together. We appreciate it. And I know one final thought to the reporters out there that are covering this. We appreciate what you're doing to help get these messages out. We appreciate NPR Radio covering this live, Ohio Channel, public television, and all the other news outlets that are doing this. Take this information seriously. Dr. Acton is talking to the best people in the world on this. The governor is talking to everybody under the sun about this, who is giving him counsel and advice and helping to make sure that we are making the best possible decisions as fast as they can be made. And we really appreciate everybody pitching in. We're all in this together. We will get through it together, and we will come out of this strong. Thank you.
Just to note, the graph that you saw up there a few minutes ago when I was talking about the spread and the alternative ways that this could turn out, right before we came on today, Dr. Acton and I were on the phone with the author of that. So, as John said, we're doing everything we can to reach out and get as much information as we can. I've asked Lori Chris, who is a member of my cabinet, Mental Health and Addiction Services, to share some thoughts with us today. This is a difficult time. People's lives are being disrupted. We want to make sure everyone remains healthy from a mental health point of view, and I thought Lori might have some thoughts and comments about that. And we'll look at Lori up here in a moment. We hope. Hi, Lori.
Hi, Governor.
Where are you speaking from?
Well, I'm in our family room, and I've had the whole family involved in helping us get set up for this today. So thanks for inviting me to join you remotely. I can't tell you how much it really means to be able to still contribute and participate fully, but stay at home just like you've asked all of us to do. And I really appreciate your emphasis, not just on our physical health, but our mental health as Ohioans too. It was just a week ago that I was here talking about how the things we're all feeling are normal: stress, anxiety, fear, grief, a little anger, some sadness. And this is science, just like public health strategies that Dr. Amy are talking about are science. Mental health care is health care. The brain is part of the body. The first thing I want you to know is that we want all Ohioans to know is that behavioral health care is open for business. It's part of the vital health care system. And so for those citizens who are already having mental health challenges and addiction issues, and you're part of the service system already, please stay in touch with your provider. Please keep your appointments. We want you to get the care that you need for those issues, and stay connected to your services and appointments. If you're not sure if you should go in for your appointment, please call your counselor, case manager, your provider, and see if you can get care through telehealth. That's available now through both phone and online through video conferencing as well. We want you to take your medications if you're prescribed medication, and to stay in touch with your prescriber and to get refills, and if you need any injections, to get those on schedule as needed. And if this is the first time you're experiencing any mental health concerns or problems with alcohol or drug use, we want you to reach out for help. Providers are still taking new patients, and we want you to reach out for help. The most important thing to know is that you are not alone. I know that we've been talking a lot about social distancing, and that really means physical distancing. There are new ways for all of us to figure out how to stay connected to care and to connected to each other socially, and we're all doing that, but you are not alone. During this crisis, we've compiled resources for all Ohioans to connect to make sure you're staying home, but still getting the support that you need. So go to coronavirus.ohio.gov and click the tab for Resources for Adults. It lists the contact information from our department, Mental Health and Addiction Services, and provides critical hotlines and resources that you would need to take care of you. And we'll continue to update this page with videos and tip sheets and trainings and other resources over the next several days and make those available to everyone. If you're in crisis right now, please use the crisis text line, which is 4HOPE to 741-741. So text 4HOPE to 741-741 if you need to talk to someone immediately. If you're thinking about hurting yourself, please call the Suicide Prevention Lifeline at 1-800-273-8255. Remember, this is temporary. You are resilient. Ohio's resilient. We have grit. Give your family a sense of hope. You've done hard things before. You can do them now. Name your challenges, set goals, and take actions to solve your problems. Some of us were already in a hard spot before this started, and so this may make it even more difficult for you right now. And we want to make sure that we're supporting you and your families. So ask for help when you need it. There's a lot of help out there. And now I just want to talk briefly about some tips for managing stress with kids and families. And these tips can be found online, and more tips as well. The first thing for all of us to remember is that kids take their cues from adults. And that's from newborns to teens. Young people feel the energy that grown-ups are putting off. And so here are some simple things we can do to help ourselves feel better and to help them feel in control as well. The first is talking with your kids about what's happening. Sometimes kids feel responsible for things that are completely out of their control, and it's important for us to talk to them and share information that's digestible for them as kids, not to talk to them as adults. It's also helpful for your family to have a plan of how you're doing your part to prevent the spread of coronavirus and to help take care of each other within the home, and for kids to have a role in that as well. So make sure you include them and encourage them to ask any questions they have and share their feelings and take those seriously. We should also all be monitoring and limiting our media exposure. There's a lot of unhelpful information out there, and we need to make sure that we're monitoring what our kids are watching, what they're hearing, and what they're reading as well. So remember, media is there 24/7 for our convenience, but not for our consumption. And we need to step away and unplug, but when we do plug back in, use trusted resources and make sure that your kids are doing the same. Most of us are not used to being with members of our family and household 24 hours a day, 7 days a week. So this is hard, and it's not always pretty. Personal space and quiet time away is important for all of us. So we need to make sure we find a way to create that within our homes, both for our kids and for adults. It's also helpful for us to remember to use our manners to keep our cool. And so saying please and thank you makes it a little bit harder to snap at each other. I know it's harder for me to yell when I'm saying, please clean up this mess. Thank you. And if I'm acting stressed out, a tool that I always use to help me get back in gear is a little acronym, little word called HALT. So HALT. If I'm feeling hungry, angry, lonely, or tired, I need to take care of myself and then go back into action supporting other people. So that's HALT. Hungry, angry, lonely, or tired. And then finally, try to maintain a routine for your family. It's different than your normal schedule each day, but make sure that you're maintaining a routine. That's really important for young people, kids in our homes, to feel secure. This is a time for us to slow down. We're not used to doing that. We can connect in new ways with our family inside and outside of our home and do those projects that we've been meaning to do, spend more time together, either in person or remotely. And remember, a smile and a kind word go a long way. So with that, I'll just say be well, stay well, physically and mentally. Thanks for the ability to be here today.
Thanks, Lori. Thank you very much. It's great. Well, as Lori said, as we go through this crisis, it's so important to stay connected, and there's many, many ways to do that. Yesterday, I got a letter from our grandson, Albert. Albert's our oldest grandchild, and Albert is working on his PhD in chemistry. He obviously did not get my science gene or lack of science gene. I think he got it from his other grandfather, who's a medical doctor, or maybe he got it from Fran too. But that was great. So I would just say to all my other grandkids who are out there maybe watching, you could also send your grandparents a letter. That would be a good thing. Fran had the idea of seeing if all the grandkids actually could send a letter to her mother. That would be their great-grandmother. And there's a picture of our family that is actually down in North Carolina. They live in North Carolina, and they're doing looks like they're making a card. So we would just stay in touch. These are not necessarily easy times, but we can kind of make fun things for the kids to do and fun things for us to do. And again, the whole idea is to stay connected. Before we open up to questions, let me just say I've been really pleased. The other day I asked, Fran had the idea of everyone, since this really is a war and we need to rally together, just like this country always does, we need to be patriotic. So Fran suggested everybody fly a flag, fly the American flag, fly the Ohio flag. And so we've started to get some pictures that people are posting. Young people are putting flags up, and older people putting flags up, and we've got a number of these pictures that have been posted. And I would just encourage you, everyone watching today, fly your flag, put that flag up, and take a picture, put it up on Facebook, put it somewhere, because we're all in this together. Happy now to take some questions from the news media. And just for those of you at home, I'm normally looking at screens that have pictures of the news media up there. They're in another room right through there. But I don't know whether, Eric, we can get them up or not. If not, we'll just I'll listen to the questions just like everybody at home is doing as well. So I don't know who has the first question.
Governor, it's Lou Ann Stoya, ABC 6, Fox 28, Columbus. First of all, we have our flag up.
Great.
We talked about the hospitals being 75 or 70% capacity right now in Ohio, but with the surge, we understand that there is a need for more beds in critical care. Can we talk about what are the spaces being created now in advance of a crisis?
Sure. I'll let Dr. Acton take that. I mean, one of the things I've talked about is at the request of the hospitals, the National Guard is erecting some tents. This is to create separation as well as additional space. But we had a conference call with a number of the CEOs of hospitals yesterday. I know they're all focused very much on that. Amy, do you have anything to add to that?
Yeah, I believe, as the governor said, we have been working closely with all the CEOs and CMOs of all the hospitals in Ohio in partnership through the Ohio Hospital Association and the Children's Hospital Association. And they've been hard at work. I know they're going to reveal more of some of their strategies. They're putting the finishing touches on that. But each of them has done all their pandemic planning internally. But each of our big cities and bigger centers are sort of in partnership with smaller hospitals regionally. As you know, this is a terribly hard time, even on hospitals. So we are already having to face some small hospital closures. So, you know, by decreasing elective surgeries, a lot of these hospitals are even having difficulty making payroll. And so I say that to say, all of them have dropped all competition. They're all working together, depending on their regional approach that they'll be describing to you next week, early next week. They are going to, you know, use the facilities they have differently. Some will be using, you know, enhanced sort of the tent capacity that you've been seeing on television. Some of them will be using perhaps old hospitals that had been closed. So there are a variety of plans being done, but they're regional in nature based on the resources available. And of course, they have to be flexible so that, you know, as we see this peak and ebb and peak in different communities, they'll be able to respond accordingly. And that's why our emergency operating center, it's like a NASA. Imagine, you know, that room with all those screens. The CDC has one. all locals. I have one in my agency, but we have one for our state, and they're constantly monitoring the state on the ground. We are constantly ear to the ground with our locals, asking, what do you need? Can we deploy? What advice can we do? How can we come up behind you and support you? So I know they look forward to sharing that plan with you in the near future.
Hi, thanks for this update. Jessie Balmert with the Cincinnati Enquirer, mostly for the health director, but come up in the past couple days. Do surgical abortions fall under the category of an elective procedure that was banned earlier in the week? Could you maybe provide some clarity there?
Yes, well, I'll direct everybody to take a look at the order. Again, the spirit of non-elective surgeries has to do with our absolute extreme shortage of the PPE and the equipment, and I know our teams are working on this. I want to say one thing. I am the doctor for 11.7 million people, and all women, no matter where they fall on this, and I think that's very important. We cannot allow the politics of things to get in the way of doing what we have to do in a state of emergency.
Hi, this is Laura Hancock from Cleveland.com. Just following up, can I get some clarity? Is there ever a time when an abortion would be considered an emergency procedure?
Look, there's an order that has been issued. I would refer people to look at that order. I'm going to let it go at that. The Attorney General is involved in regard to that order, and I would refer things like this to the Attorney General at this point. These are fact-driven issues. It's very difficult to answer without knowing all the facts.
Just really quick, we have spoken to some readers, including one who is a physician at a hospital and is having respiratory symptoms and is having trouble getting a COVID-19 test. And so do you guys know what the situation is with the healthcare providers getting tested? I know that they're considered priority, right?
Laura, was that Christ Hospital that you're referring to?
I don't think so, but...
Yeah, there was a situation I've been made aware of. Absolutely, if they're in a hospital, that hospital should be working. If they don't have the test, go to your nearest major medical center. But I was aware of a situation, it's about 2 to 3 days old now, where our lab helped them figure that out. And I think there was a travel, like somebody was a citizen of another state. So that particular situation has been, I believe, looked into.
Hi, Beth Berger, Columbus Dispatch. Thanks so much for taking my question. I wanted to follow up on something that Dr. Acton said earlier during her statement. She said that we're taking people off ventilators. Does that suggest that we'll be having more deaths or that patients are recovering? If you could elaborate on that.
You know, at this stage, we have not been able yet to follow somebody through to full recovery, but if you look at the areas where they're ahead of us, we certainly will be seeing that in days to come. Remember, 80% of us will stay at home with this, and we will, recover. We'll watch for signs of it worsening to go to the hospital. It's not always it can be up to 2 weeks of not feeling well, but we will recover. We are early on in our illnesses and deaths, so I have not had the case stories of people that I'll be sharing with you and enjoying sharing with you in days to come. But we will be seeing more deaths. We expect that as part of this spreading and more people becoming infected. And, there are folks who, despite all heroic measures, are not going to make it with this. I want to say something again while I have the moment about testing. Ohioans, I absolutely know. I want you to know every ounce of test we have, every nasal swab, everything is being maximized in Ohio. It's complicated. There's no one's fault. It's not something that we did in Ohio to not have this capability. But what we have to do in my job, again, the hard decisions, is using what we have as we have it well. We have great innovation going on where we're going to build our own kits, and you'll see my fellow states doing the same thing. That's why media is so important, actually, because when I tell you about these innovations, this is changing so rapidly. When you post a story about something going on in Cuyahoga, that will get to my fellow states faster than any conference call a week from now, with my colleagues. And that's why I'm asking the media to help get stories of innovation. But for you at home, for most of us, that test will not make a difference in how you're treated. So if you're a person who can really ride this out and your doctor has said, stay home, here are the measures, and let me know if you have worsening breathing or something, knowing that test will not have changed like the actual treatment that your provider will be doing with you. So we have a tiered plan on testing that was put out in a health alert to all primary care doctors, I believe, yesterday. And I think, I know it's hard. I know at our call center, the 833-4-ASK-ODH, that is the #1 asked question about testing. And I know people, are afraid that they can't be tested. But what I want you to do is really in Ohio assume you might be asymptomatic, or even if you have it, I want you to just know that test will not change how we're going to help you get through it.
Governor, this is Jake Zuckerman from the Ohio Capital Journal. You mentioned a week ago that you were getting texts of the bars filled up for the Saturday before St. Patrick's Day. You made similar remarks today. Do you think people are ignoring good advice? Do you think they're not understanding the advice they're being given? I mean, why are people...
Look, I think a lot of people, I think the majority of Ohioans understand it. I think they get it. But look, this is still difficult for people. This is a silent enemy. This is an invisible enemy. We don't see this. And so when we do the modeling, not that I do the modeling, but when we look at modeling, when we do projections, when we talk to people and then try to convey that to the people of Ohio, they're not seeing it. So I think the vast majority of Ohioans get it. I think that we still have some education to do to some of our fellow citizens. And again, that's why I made the remarks that I made today. We really control our destiny. It's here. How it spreads, how fast it spreads, we control. I mean, part of it is what we order. We've ordered a lot of things. We'll order other things. But a lot of it's going to come down to what I do in my life, what you do in your life, what every one of 11.7 million Ohioans do in their lives, and what they don't do. So I just, I'm asking people to be very conscious of that. And as I said, what I think about every night is, have I done all I could do? I would ask every Ohioan when they go to bed to think the same thing. Hey, have I done everything I can to avoid the spread? Did I do the things during the day and not do the things that I knew were going to cause some spread? So we can't do this just with orders. We have to have people really, really, really engaged. And there has to be a sense of urgency, and there has to be a sense of understanding the gravity of this. We're playing for big stakes here. Lives are at stake, and a lot of lives are at stake.
Thank you. Hello, this question is for Dr. Acton. This is Ori Givens from Spectrum News 1. We've been getting a lot of feedback from pharmacists about various issues, whether it's PPE or distancing in grocery stores. We have one big concern that they're seeing a lot of prescriptions for a drug called hydroxychloroquine, which I guess the president also tweeted about today. Can you just talk to the policy around that drug, and should we be seeing all these prescriptions at this time?
As Dr. Fauci said, this is an experimental, compassionate use of this drug because, of course, in the time frames we're seeing, no one's able to do those trials yet. There were some thoughts of its use in China and elsewhere, I believe France. But it's important to know that this drug is very, very vital to people with rheumatologic diseases. There are other uses of this anti-malarial drug. And we can't have a rush on this drug in asymptomatic people. This is a drug you take when the governor does so much work in Haiti. When we went there on a trip, this is what you take as prophylaxis for malaria. there's a limited supply of it. And similarly, again, we're talking, this is a social contract, folks. We've got to work together. I've worked specifically, my team has reached out to the pharmacy board. We've got to limit the prescription to 14 days if we are going to use it in these compassionate use circumstances, so that people don't just stockpile it and try to sell it or misuse it, because there are patients who have autoimmune diseases and arthritic diseases. The rheumatologists are really speaking up right now. I think this would be a great thing at the federal level as well to take a look at, because we want to be flexible here as we try everything we can. And again, everyone's trying everything they can, but we also have to think about, those other complications as you're mentioning. Thank you.
Thank you.
Hey everyone, Andy Chow with Ohio Public Radio and Television State House News Bureau. For the governor and Dr. Acton, you've been pretty transparent in the fact that Ohio doesn't have a lot of tests, and so we sort of have to assume that if somebody's sick, they have to have it. But without the clarity in the number of cases that Ohio has, what kind of data is out there for hospitals to prepare for this storm that's coming? Will they know when they're about to get hit by all of this?
Yeah, let me just start it, and then I'll turn it over to the expert here. But what we have been saying in every one of these 2 o'clock or 2:30, whenever we start, press conferences, is this stuff is here. It's already here. We already have community spread. We don't have to have tests to know that. We know that because all the experts tell us how this progresses. It would appear to be progressing in Ohio as was predicted. So these hospitals are trying to figure out exactly, where they're going, but I will guarantee you from talking to the CEOs, each one of them is really focused on it like a laser. I mean, and they have been focused on it. They didn't just wake up this morning and say, oh, we're going to have a problem. So Dr. Acton.
Absolutely. So all modeling is very difficult when you don't have numbers, but that said, there are a number of people who have been tested, but it was sent, remember early on our criteria was sending people who are outpatient to the private labs like the LabCorps and Quest. Well, many of those tests are taking a long time to come back. So we know there are a lot more people tested that were already suspected. There are presumptive cases. There are contacts being traced, and there are clusters. So at more the regional level, that's why I keep pointing out, go look at Cuyahoga. I highly recommend you go talk. Just an amazing doctor there. Again, there's so many heroes in this. What they're doing there and inventing, which we will be using all over the state. They're being able to do some early epi curves and modeling. We have some great statisticians and modelers that we're usurping from all the best universities here in Ohio who are kind of trying to build up that bandwidth to give some of those numbers. Also, the Ohio Hospital Association, they sit on a lot of data about routine usage in hospitals, influenza-like illnesses, and other data. So they are actually doing some modeling. So a group of people are coming together to try to do the best. But even the CEOs asked me, could I say exactly when a given community surge will happen? And it's really, I can't accurately say that prediction, but what they're watching is what they're seeing in their own ERs right now. They're at 70%-ish capacity across the board because it's a heavy flu season. So you'll see a lot of that modeling as we have better and better data. And my sincere hope to everyone is we're going after testing. So the second we have it, we're going to be out there doing every surveillance, every cluster, full court. We were all built up for it. We had an amazing Cleveland Clinic, Ohio State. They had already, many hospitals around the state had built up this testing capability with a doctor's order, but literally ran out of swabs. So, they had to stop. And again, we'll all look at all this in postmortem. There's so much to this. It's really easy to play a blame game. It's really easy to give in to politics. And I just beg of people, we have to do what we can do with what we have now. And that's how we're focused in Ohio. That's how, other state health officers are looking at this. They're also great people to go talk to across this country. State health officers could tell you a lot about what they're seeing and then refer you to people who are really on the battleground in the local health departments.
All right, thank you.
Governor, this is Noah Blundo with Hannah News Service. You've had sign interpreters at a lot of these briefings, and I wonder where you would direct people who need reliable information on the situation in other languages?
Good question. That is a good question. I don't know what we have available. You know, Amy?
Yeah, early on we engaged to have some of our materials translated, and that work is ongoing and needs to catch up, absolutely. I think we have really got to, we're changing our guidance almost daily. Even our notes to our doctors are going out that one day and then the next day. So I know that our agency is contracted to have people do that. We have huge populations in Ohio, Somali, Nepalese, in addition to the Spanish, which was easier to do right on. So we are actively translating this show. I just saw in the sign in Spanish, so I did not know that. So that's wonderful. But we have to get these messages out. And again, we're all watching this right now. Those of you who have, again, it's just been amazing. We were just talking to a small group of media when this began, and now we realize there's a following of people who are relying on this news every day we do it. But there are tons of people, for various reasons, whether they're working or whatever, are not watching this. You keep saying that. Lieutenant Governor keeps reminding me, how are we going to tell you to batten down the hatches and get that to everywhere it needs to be? We need the faith-based community to help us in this, all those small churches and stuff. We need people going to good sources of information, coronavirus.ohio.gov, and then translating it to their audiences, whether you're a YMCA or whether you have a small parish. We really need your help. I know all the legislators and lawmakers and leaders of cities and communities, big and small, are trying to use the same talking points that we're using, and that's why all of us coming together to one source of information is so important. Thank you.
Thank you.
Hi, Laura Hancock again from Cleveland.com. Dr. Acton, do you have any information on this newest death out of Cuyahoga County? Age, anything?
For the local things, I know they're going to come to you. I do know it's a 91-year-old gentleman, and my condolences go out to his family and to his wife. And they'll tell you more of the history and the surrounding story. So it's more a reason to go talk to them. Thank you.
Thanks.
Sierra Johnson, 10 TV News. As we work to eliminate that risk of clusters and the community spread, any thoughts on the plans or orders in the pipeline regarding our jails and our holding centers and some of our prisons?
Well, we continue to work with our sheriffs on that. We had an order very, very early on in this in regard to our prisons as far as no visitation. No visitors. We know that's tough on everyone, but we wanted to cut that out. Very important. We also have a protocol in place, and the same way with the jails. One of the issues that I know the director has been working with sheriffs on is the transport when someone comes out of a jail and goes into the state prison, and that is something that we have to be very, very careful of. Anytime we move anybody from anywhere to someplace else, you wonder, worry about that spread. So I know the director's been working very closely with the sheriffs around the state.
Any thoughts on early release of anyone?
Well, again, I would have to talk with the director about that. I mean, we're not looking at early release out of the prison system. But in the county jails, that is under the jurisdiction of the court, and so that I would refer that to the local court system. They're the ones who decide. They're involved. They're looking at their own jail. They have to make the determinations how much space they have. They must make the determinations about who is going in and who gets released. So that's really a local decision by the local court.
Thank you.
Governor Andy Chow again, and for Dr. Acton, two questions that we keep getting almost every day. One is, do you know how many cases of COVID-19 we have in Ohio of people under the age of 18? And then also, the idea of, is the virus more of a risk to pregnant women? The idea of pregnant women and needing to go to work, I know that there's not a lot of data out there, but that's something that we keep getting asked a lot.
I don't have a breakdown of the ages other than we know our age range starts at 1 and goes to 91, and I'll see what I can do about more of that data. It's so hard right now, I have to tell you. there's so much data coming in from so many places. Again, 247 cases today. And then your second question.
Are pregnant women
Pregnant
more at
women,
risk
yes.
of?
Okay. So the studies, there's been a little bit of study out there, but the numbers are very small. So there isn't a lot. There's not indication yet based on the one small study sample I saw. And we'll try to get that on our website. But what I can say is for pregnant women, they, as your doctor will probably talk to you, getting any infection during pregnancy, it's really a fever that is often something like if you catch the flu. So, take your doctor's advice. Obviously, again, I've had several friends who are expecting and have asked me that same question. And I really want you doing what I want everyone else doing, which is really make your circle as small as possible, follow all the precautions we've given you, stay at home if you at all can, and limit your exposure and keep following that guidance. And let your doctor know if you're not feeling well, stay in close contact with your provider. Thank you.
Thank you.
Hey, Beth Berger, Columbus Dispatch again. One more other question. I just wanted to go back to the ventilators. We know that there's a shortage nationwide. And when you said we were taking people off ventilators, are we talking about a scenario where doctors in our state are having to choose between one coronavirus patient to the next on who gets, the resources? Are we to that point now?
No, we are not at that point right now in Ohio, thank goodness. And everything we're doing and everything we're asking of you is so we never get to that point.
Do we have a plan in terms of ventilators if we do have a shortage and the
Yes.
infection rate rises? Can you elaborate on that?
Yes, and as I've mentioned, we're pulling together numbers to get a sense of what's out there across the state. But I can tell you, given some of the projections on the surge, we know that, if you look at some of the national data, without even looking at Ohio data, you'll notice that bed numbers and this equipment does not add up. So what we're doing here in Ohio is we are repurposing a lot of things, including anesthesia, typical anesthesia. We're not doing a lot of elective surgery, so we are actually looking at using all that. There are manual ventilators. I know the president talked today about what's in the stockpile, but there are sort of some lower tech, not as elaborate type of mechanical ventilators that are still out there. We have a stash of those as well. But what we're looking at is what all could we use across every venue in Ohio, not necessarily sitting in a hospital today as part of their routine equipment. We're looking at ECMO and other things that are used in ICUs. So the hospitals in that work are looking at all that. Everything we're doing is to not have to make those difficult decisions. And the CDC has put out some guidance based on how do you make and how do you do that and how do you maximize that capacity. So that would be worth looking at as well.
Thank you.
Laura Hancock again, cleveland.com. Dr. Acton, I believe you talked a little bit about the clusters, and I was unclear. Are you saying the clusters are in those metro and county areas that you mentioned at nursing homes, or are the nursing home situations separate? Can you kind of explain what you were, the clusters?
And losing all other cluster definitions as well, because that crossed my mind. So what I'm saying by cluster is it's really an epidemiologic term. But we're really looking at that spread in a area based on those contact investigations and the work the disease detectors are doing. So you might see that. Remember early on I talked about, nursing homes where we were seeing influenza-like illness, but they were testing negative for flu. To me, that's something that, puts a flag up as something else going on there. And maybe that was going on early on as now we're seeing some of the data. And that includes, and there's guidance out there as well as coroner-related work that's underway. But a cluster might be in a family or in a school. I know one of the situations that Tuscarawas is facing right now, and they can tell you more details about it, is you have a situation where sometimes some of our, and this may have happened in Dayton as well, but please defer to the local to give you details. But you might have somebody that is a physician that is going to hospitals and is going also to nursing homes, perhaps giving care in multiple sites, that then comes down with the illness and has then, in fact, been in contact with a lot. So as you can imagine, investigating all this takes tremendous manpower, and so those are the things that we're looking at to try to, these new measures we're doing for all of us. We're still doing all the old stuff we were doing to contain this, and we track everyone down and try to lock that down and let everyone know who might have come in contact to be, even if they're not symptomatic, quarantining for the full 14 days, because we want to limit that expansion of that cluster.
Thank you.
Governor Eric Halpern with NBC4. I've been told I am the last question today. We have gotten a lot of calls from places around the state about big mills or plants that employ hundreds of people, that they're still open. There's still a lot of people at work, about why those places are still open. Are there going to be any more orders to maybe control some of that?
Well, we've done all the orders we're going to do for today. Stay tuned. We'll be back tomorrow.
Any more specifics on some of those big mills or plants, though, that are still open?
No, not today. Nothing else. We've issued the orders we've issued, and I just will close again by saying that the orders we issue are issued for the purpose of protecting human life. We think obviously they're very, very, very necessary, but ultimately, how well we come out of this, how well we slow this down, is going to depend on what each and every one of you do every single day. And so that's my message of the day. I guess it's been my message every day, but we have our destiny in our hands. This stuff is here. It's bad, but we can really slow it down. And we've taken some measures, and many of you are doing things. Thank you for what you're doing. Thank you for what you're not doing. We got to get everybody on board. Every one of your fellow citizens needs to be doing the same thing, because this is a case where what we do not only impacts us and our family, it impacts total strangers. So we got to slow this thing down. The virus cannot jump without our help, and let's all get on board and do what we have to do. Thank you very much. We'll see you all tomorrow at we hope 2 o'clock. Thank you.
And that's Governor Mike DeWine's daily press briefing, which we have just learned that 247 confirmed cases of coronavirus in Ohio in 33 counties. That also includes 3 deaths. The death that was announced yesterday in Lucas County, the death of Mark Wagner Sr., and today announced deaths in Cuyahoga and Erie counties. We just found out that the one in Cuyahoga County was a 91-year-old man. 58 hospitalizations, many in the intensive care unit. Onset of illness all the way back to February 7th to March 19th. And the age of the patients range from 1 year old to that 91-year-old man, the median age of 51. There were a couple of orders that Governor Mike DeWine issued today. He's opening the Emergency Operating Center, the EOC. This is a facility that manages things for the state during times of disaster, such as weather situations, flooding, that sort of a thing. And he said it will help with the supply chain and try to manage some of these things that are coming in. Closing adult day services for people with disabilities. Those are facilities where people are getting work training and are having socialization, but they're larger groups. And he says that those folks will get that training and have that opportunity for socialization in smaller groups of 10 or less. There are about 26,000 people that are affected by that. Also, the state is allowing businesses to forego payments to the Bureau of Workers' Compensation for March through May, deferring those payments to June 1st. And the state will be granting waivers on truck weight limits to allow for larger loads to go to grocery stores and medical facilities. So my colleague Andy Chow is back here joining me. So what else did we hear in this press conference that you want to highlight here?
I think an interesting thing, and it's sort of keeping in what they've been doing on these Saturday and Sunday press briefings, is really stressing the importance of mental health during this whole time. You saw the director of the Ohio Department of Mental Health and Addiction Services, Lori Chris, through a video chat, which I thought was very interesting, and it was a good example of how people are trying to keep their distance from everybody else. Director Chris basically said, listen, you're going to be cooped at home. You're going to be dealing with a lot of stress and a lot of anxiety with pandemics. The studies have shown that it's very common to feel anxiety, stress, grief, fear. And so she talked about the resources that are out there for people. The Mental Health and Addiction Services Department provides a lot of those resources and has links and phone numbers to call for that. Really encouraging people to reach out. And we've been talking about this a lot, how the regulations on telehealth have been lifted for a lot of these services so people can still call into a provider and get the help that they need. And I thought that was an interesting and important message to be spreading at this time. I thought the things that Lieutenant Governor John Husted put out there on the regulations of Bureau of Workers' Compensation allowing for delayed payments, and then the trucking waiver. Interesting, we talked about earlier, getting into the weeds of things. This is something that's been talked about for a while here in the state, is trying to get these waivers. And so I believe that what it seems like in the DeWine administration is that something as important as keeping the food chain going, something as important as constantly supplying those medical equipments, that's something that apparently to the DeWine administration is qualifies for a waiver.
And this all joins an announcement that was made yesterday about health insurance payments to the Department of Insurance. Those have been deferred as well. So this is some of the relief that the state is trying to provide to some businesses. One thing that did come up is that the cancellation of elective surgeries is apparently resulting in the closure of abortion clinics, and that's gotten some feedback from pro-choice groups.
Yes, and this is something that is going to be talked about a lot in the upcoming days and weeks. And when reporters sort of tried to press Governor DeWine on the issue, he sort of tried to just direct people to the public health order. The public health order, when it comes to elective surgeries, spelled out that an essential surgery had to be something that protected your life, protected you loss of limb, protected you from preventing a disease from getting worse, or symptoms to worsen. And so basically that was his answer. You could basically tell that he wasn't wanting to answer the question. And then Dr. Acton was pretty straightforward too in saying that she didn't want this to become political, but there are groups out there who say this is a very important thing, this is an important service for people. So, when it comes to abortion, this is a fight that is sure to continue.
And also, once again, the whole discussion of trying to flatten that curve. Dr. Acton was saying that there may be this fallacy that this disease will not hit middle America like you're seeing it hit in Seattle and New York City, and she said that's not the case.
Right, and this is, and you sort of heard it again a little bit later, really urging faith-based organizations to get the word out, because I think what we're hearing reports of around the state is that smaller churches are maybe still planning to get together tomorrow. Now, we know that throughout these public health orders, Governor Mike DeWine has been trying as hard as he has been clear that he wants to not overstep First Amendment rights. So he's not going to do things that limit your free speech. He's not going to do things that limit your freedom to religion. But Dr. Acton is saying, listen, you might think that you're in small town America, that you're in a rural part of Ohio. You are still somebody who can be susceptible to this virus. And if you're gathering in a group at a church, that is conducive to spreading this virus.
A lot of churches are now doing online services, doing services on Facebook Live, trying to find other ways to help people with fellowship, but not getting them together. So I want to ask one quick question here. Essential, non-essential businesses, that whole issue, and daycares, the governor said those orders were not today, but he's still cautioning businesses to be safe with their employees.
And you know what? I left the room as I was about to run down to be here, and I think what I heard is that there's more to come, and I think people were asking about certain businesses.
We'll be here tomorrow.
Yeah, we'll be here tomorrow, and we don't have church, so I think he's been very clear in forecasting that there are more closures to come when it comes to businesses, and trying to thread that needle of what is essential, what is not essential. And we've talked about this over and over again, that if you're going to close down daycares, maybe you need to also shut down non-essential businesses. So, if people are forced to go to job at a quote-unquote non-essential business, then they need somebody to take care of their kids. If you can do that in tandem, then maybe you sort of lighten the load for a lot of people.
I know that DeWine has also said that the number of kids in those daycare centers has been dropping, but that the kids who are still in these daycare centers may be the children of workers who are in healthcare, who are at grocery stores, who are at restaurants, that are doing carry-out, and other businesses that are still operating.
And I think it's also important to, and he mentioned this a couple of days ago too, is that there are some people who are in an economic position to be able to pull their kids from daycare, to maybe allow them to stay with a family member or to be able to take the time off. And there are other people in an economic situation where they cannot do that. And so, that might be hurting people in some ways too. So again, it's about threading this needle to figure out exactly what you're supposed to do when it comes to closing down daycares and when it comes to closing down what are known as non-essential businesses. And we're very candid in saying this is quote-unquote non-essential.
Right, it's an essential business maybe to you, but it's hard to define necessarily in a directive. One thing, unemployment.ohio.gov, that's where people are being directed to file claims for unemployment, because the phone lines are really bad to this on a public television station. A lot of our partners in public radio and public television do have information and resources for kids who are at home, who are not going to be at school, and DeWine has hinted that school may not come back this academic year, that certainly that order to close schools going through April 3rd is going to have to be extended, but there are resources available on public radio and public television websites, and the state also has some resources. Andy talked about some resources for people who are concerned about their mental health. So 247 confirmed coronavirus cases in 33 counties, 3 deaths announced today, 58 hospitalizations, and that's where we are right now. And we will be back here. We will be back here tomorrow for another press conference, but that concludes our live coverage of Governor Mike DeWine's daily update on coronavirus in Ohio. For more information, tune into Ohio's public radio and television stations. And also you can go to our website, statenews.org, for information. My thanks to my colleague, Andy Chow, and the crew at Ohio Government Telecommunications, also the Ohio channel right here. I am Karen Kassler. Thanks for tuning in, and have a good evening tonight. And we will be back at 2 o'clock tomorrow morning to hear the latest on coronavirus in Ohio from Governor Mike DeWine, Dr. Amy Acton, and Lieutenant Governor John Husted. Thanks for watching and for listening.
You are watching the Ohio channel. Any duplication, retransmission, or other use of any portion of this service without the express written consent of the Ohio channel is strictly prohibited.